Today we're going to talk about the signs of a silent heart attack that many people overlook, and if we don't take care, it can result in something fatal. Let's explore the 12 signs that we can't afford to ignore. Pay attention until the end to understand why these symptoms occur and how you can identify each one of them. This is an instructive video, so if you immediately notice these signs in yourself or someone else, we recommend seeking specialized medical help promptly. First, let's start by talking about persistent headaches, which can easily go unnoticed. This happens because when the coronary arteries are blocked, the supply of oxygenated blood to the brain can be compromised. This triggers a response from the nervous system, which can result in persistent headaches. Additionally, chemicals released by the body in response to stress, such as noradrenaline, can contribute to the sensation of pain. Second, also pay attention to the signs of nausea and vomiting. When the heart isn't receiving enough oxygen due to an obstruction in the coronary arteries, the body goes into alert mode, releasing hormones like adrenaline. This can cause a feeling of nausea and discomfort in the stomach, leading to nausea and, in some cases, vomiting. It's like the body is trying to rid itself of the extra stress, but in a way that's not necessarily effective or pleasant. It's important to pay attention to these symptoms, especially if they occur along with other signs of a possible silent heart attack. It's important to know the difference between a common heart attack and a silent heart attack. A common heart attack is usually like what we see in movies. There's always someone clutching their chest in severe pain, sweating, and short of breath. It's as if the body is screaming loudly, and it's hard for anyone to ignore. On the other hand, a silent heart attack can occur without these classic signs. Instead, the symptoms may be more subtle, like extreme fatigue, mild chest discomfort, or even just a simple headache. These signs are less obvious and can be easily ignored or mistaken for other conditions. That's the main difference between the two types of heart attacks: one is evident, and the other can go unnoticed. Another often overlooked symptom of a silent heart attack is dizziness or vertigo. When there's a blockage in the coronary arteries, blood flow to the brain can be compromised, leading to these symptoms. Additionally, the lack of oxygen in the heart can trigger a response from the nervous system, leading to a sensation of imbalance. It's like your body is trying to alert you that something is interfering with the normal flow of blood and oxygen, and you're feeling it as dizziness or vertigo. Pay attention to anxiety or panic as well, as it may not be just an emotional issue. Feeling unexplained anxiety or panic can also be a sign of a possible silent heart attack. This happens because the heart, not receiving enough oxygen due to an obstruction in the coronary arteries, sends stress signals to the brain. This triggers a fight or flight response from the body, releasing hormones like adrenaline, which can cause feelings of anxiety and panic. You may feel restless, with a racing heart and a sense of apprehension, even if there's no obvious cause for it. It's like your body is trying to alert you that something's wrong, and you're feeling it as a wave of anxiety seemingly out of nowhere. Also, pay attention to extreme fatigue, as it may not just be a sign of tiredness. This happens because when the heart isn't receiving enough oxygen due to an obstruction in the coronary arteries, the body goes into a state of stress and extra effort to try to compensate for this lack. This can leave a person feeling extremely tired, as if they've exerted themselves greatly, even without having done anything. It's like the body is asking for extra time to rest and recover. Imagine yourself running a marathon without proper training. The feeling of exhaustion can be similar. Another symptom to consider is back pain. When there's a partial or complete blockage in one of the coronary arteries, which are responsible for supplying oxygen-rich blood to the heart, this can cause back pain. That is, the pain may start in the chest and radiate to the back because the nerves that transmit pain from the heart are also connected to the back regions. It's like the heart is sending out a distress signal that manifests as back pain. Imagine yourself as a detective, following the clues of where the pain is coming from, and often, it leads to the heart. Also, be alert to excessive sweating. Excessive sweating is the body's response to the stress and anxiety caused by the lack of oxygen in the heart. When the heart isn't receiving enough oxygen due to an obstruction in the coronary arteries, the body goes into alert mode, releasing hormones like adrenaline to try to compensate. This can lead to an increase in sweating, even without physical exercise or being in a hot environment. Excessive sweating may be accompanied by a feeling of nervousness or agitation and is a sign that something's wrong with the heart. Silent heart attacks can also present discomfort in other parts of the body. Discomfort in other parts of the body, such as arms, jaw, neck, or back, may be a sign that something's wrong with the heart. This happens because when blood flow to the heart is reduced due to an obstruction in the arteries, other parts of the body may begin to feel the effects of this lack of oxygen. This sensation can be described as pressure, tingling, or even pain in different areas of the body. It's like the heart is sending warning signals to the rest of the body, indicating that something's wrong and needs to be investigated. We should also pay attention to recurrent indigestion. Feeling indigestion frequently, such as heartburn, stomach burning, or feeling full even without eating much, can be a sign of a silent heart attack manifesting. This happens because the heart and digestive system share some nerves and are interconnected. When there's a blockage in the coronary arteries, blood flow to the digestive system can be affected, resulting in symptoms of indigestion. Additionally, the lack of oxygen in the heart can trigger a body response that causes gastrointestinal discomfort. Therefore, if you notice that you're having persistent digestive problems, especially if it's not related to specific foods you've eaten, it's important to pay attention, as it may be a warning sign from your heart. We must also pay attention to swelling or fluid retention. Swelling or fluid retention, especially in the legs, ankles, or abdomen, can be a warning sign of a possible silent heart attack. This happens because the weakened heart due to lack of oxygen may not pump efficiently, leading to an accumulation of fluids in the body tissues. Additionally, the release of stress-related hormones, such as aldosterone, can contribute to fluid retention. We can't forget about chest discomfort. When chest discomfort occurs, it may feel like pressure, tightness, or pain in the chest, often mistaken for heartburn or indigestion. This happens because the heart isn't receiving enough oxygen due to a blockage in the coronary arteries. This obstruction can be caused by the buildup of fatty plaques, which impede proper blood flow to the heart. As a result, the heart muscle begins to send pain signals, which can be perceived as discomfort in the chest. This sensation may be similar to pressure or heaviness in the center of the chest and may be accompanied by a tight sensation. Another important point is about shortness of breath. This happens because the heart isn't functioning properly to pump oxygenated blood to the rest of the body. When this happens, the body goes into an alert state, and the lack of oxygen can lead to a feeling of shortness of breath. This can be compared to feeling as if you've just run a marathon, even without having made any physical effort. Shortness of breath may be accompanied by rapid and shallow breathing and is a sign that the body needs more oxygen than it's receiving. It's worth remembering that these signs may vary from person to person, and not everyone will experience all these symptoms together. However, it's important to be aware of the signs of a silent heart attack and seek medical help if concerns arise. Leave your like below, subscribe to the channel, and turn on the notification bell. Also, check out other videos that can make all the difference when it comes to identifying the signs your body is sending to tell you that something's wrong. Thank you for watching this video until the end, and see you soon.